It's a great day to talk vitamin D, sunscreen, COVID-19, and chronic joint pain, muscle pain. That's right, they're all related. And let's look at the big picture. Let's start with vitamin D. Where do we get vitamin D? We get it from the sun. When the sun is on our exposed skin, it creates vitamin D, it gets activated into its active form, and then it impacts the body. But guess what? Vitamin D is not a vitamin. It's actually a hormone. So that activated vitamin D is a hormone, and then it impacts lots of parts of your body. It impacts your immune system. It affects your musculoskeletal system. It impacts all sorts of different reactions within your body. It shuts down inflammation, as a matter of fact. So there's lots of things that vitamin D does, and you get it from the sun. So that means if you're outside, all covered up, wearing sunscreens, you're not going to get any vitamin D, and your vitamin D levels are going to be low. Now, about sunscreens, there's different types of sunscreens, because you do want to prevent yourself from getting burned by the sun, because when you get burned, that's when you get skin cancer. You get the risk for it. You don't get it immediately, but it's every time you get burned, you're more at risk for skin cancer. So number one, your best defense against skin cancer might be a healthy tan where you don't burn. But if you do want to use a sunscreen, there's sunscreens that are made with chemical barriers, and there's sunscreens that are made with mechanical barriers. Chemical barriers are chemicals that prevent the sun from getting into your body and causing a tan and burning. Those ultraviolet B rays are blocked by chemicals. A lot of those chemicals are hormone disruptors. They impact your body, your hormone levels, okay, in all different levels. Not a good choice. Barrier sunscreens are made with zinc oxide, titanium oxide. They're barriers, and they prevent the sun from getting to your skin. Good choice. Now, if you're concerned about whether your sunscreen's a good choice or a bad choice, go to this website, the Environmental Working Group, EWG.org. It's a think tank, and it'll have a list of all the different sunscreens, over 100, as well as cosmetic and personal care products, and it grades them on safety. Are there chemicals in there that are hormone disruptors? Are there chemicals in there that are precancerous? Or are there chemicals that are safe? Check it out. So vitamin D is important. Sunscreens have a place. But what about joint pain, muscular pain? Well, there is a lot of research that shows that vitamin D levels are related to chronic pain. And fibromyalgia, for example. A lot of people with fibromyalgia have low vitamin D levels. It's also been shown that vitamin D levels, when they're called in a robust level, suppress inflammation. And we'll talk about robust level in a moment. But suppressing inflammation means you're going to have less pain. You're going to feel healthier. And how does it do that? Well, there's different types of pain. There's pain that comes from inflammation. There's pain that comes from nerve irritation, nociceptive pain. And vitamin D impacts both of those. But you have to have enough. However, just because you have enough vitamin D, you still might have chronic pain. In Sweden, they did a research, and they said, hey, our people that have chronic back pain all have adequate vitamin D levels. Well, maybe that's because in Sweden they eat a lot of cod liver oil and cold water fishes that contain vitamin D. So those chronic pain people are getting it from something else. But if you're indoors, if you're using sunscreen, and you're not taking foods that are high in vitamin D, like cod liver oil, or enhanced with vitamin D, like milk or something, a lot of it, you're going to be low. And what does that mean? That means your level is below 40. 30 is the cutoff for deficiency, but if you have to be 40 or above to be considered robust, to get an anti-inflammatory effect, to get a pain-relieving effect, and to get an immune-boosting effect, and we're going to talk about that last. So how do you do that? You get it measured with a simple blood test. And what you have measured is your 25-dihydroxy vitamin D level. That's right, it's your 25-dihydroxy vitamin D level. That's the vitamin D level that's sustained over time. The active form of vitamin D, the 123, isn't as good an indicator of your vitamin D status. So when you have it checked, ask your doctor on the 25-dihydroxy. It's got to be at least 40. I like it 50 to 70. It can go up to 125 without any problems at all. So that can also be checked with a simple finger prick bloods, but just make sure you're checking the 25-dihydroxy. So robust, high levels, adequate levels of vitamin D are immune boosters. That's right, they're immune boosters. They suppress the inflammatory cytokines that lead to not only inflammation but to disease. There is very solid research that vitamin D levels that are adequate improve your mucous membranes. Mucous membranes line your sinuses, line your nose, line your mouth, your throat, your whole intestinal system. That means the research also indicates vitamin D levels are excellent for preventing respiratory infections, common colds, the flu, COVID-19, strep throat. Take vitamin D. Make sure it's in the adequate range and you'll have stronger immune system. You'll have less risk for getting sick. You'll have less chronic pain and inflammation, and your musculoskeletal health will be better. It also helps with coordination. It also helps with balance, and this is all research evidence. How much do you need? We recommend between 4,000 and 7,000 units a day to get you in that 40 to 50 nanomoles per liter, all right? Also has shown that taking a big bolus, 50,000 units once a week, is not as effective as taking small dosages every day. It's pretty simple. You need vitamin D for joint health, muscular health, for coordination, to balance so many other hormones in your body. You can take it to suppress inflammation and pain. You can take it to improve your immune response and make you more resilient from disease and infections, no matter what it is, which means you'll have a choice to choose health and wellness and a lifestyle that's going to keep you active, or just hang out and wait for something to happen. And lastly, make sure it's in an adequate range. It's a simple blood test, so get it checked. If you need sunscreen, use it. If you don't need sunscreen, don't use it. The bottom line is use a safe sunscreen. So think about it. Vitamin D, sunscreens, chronic pain, COVID-19, they're all related. Now you can make some choices. I'm Dr. Donald DeFabio. Thanks for tuning in. Hey, like, subscribe. I'll see you on the next video.